Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. If you're a first-time listener just tuning in, thank you for joining me today. If someone you love is frustrated with something they've been suffering with and no doctor has been able to help them, I hope you'll find the material I present here each week useful. My mission each week with this show is to arm you with reliable information you can use to fill the gap between standard medicine that most people get when they show up in most doctors' offices. The gap between that and maybe why you're still not getting what you want or what you need or what you feel like you should have. Results, feeling better, feeling like yourself again. Why do you still have unexplained symptoms that are very real? So here's one of the most important things anyone can take away from any episode of this program. And it's a little bit of a challenging conversation, but it's important. It's just if you don't, people don't believe this. And so I hope you will. And it is this. People who feel fine with no symptoms, healthy as a horse, suddenly drop dead every day. What? Did he really say that? He's beginning his show by talking about people dropping dead? Yes, it's important for people to understand this. If you're still convinced that you're fine because you feel fine, then I'm really glad you tuned in, because the message is this. The important thing to understand is how you feel is a very poor indicator of how healthy you are. Most of the time, people go to the doctor when they don't feel healthy anymore, when they feel sick, and there's nothing wrong with it. That totally makes sense. That is the practice of medicine. If you show up to most doctors' offices when you feel fine, maybe for an annual physical or for whatever reason, they're going to, see if you need medical care today. Do some basic tests, make sure your cholesterol is not high enough to recommend a statin drug, make sure your blood pressure is not too high, make sure you don't need medical care today. And if you leave and you don't have any of the things that trigger some evidence that you need a pharmaceutical, some kind of a medication, or a follow-up test, or a referral to a specialist, when you walk out of that typical annual physical, regular doctor's visit, and you don't have any of those things, you're told you have a clean bill of health. There's nothing wrong with you. And people assume that means you're healthy. It does not. When you leave a doctor's office without any recommendation for medical care right now, you could drop dead next week. It happens all the time. What I'm trying to say is people assume that if they've been to a doctor and he knows what he's doing and he's checked them and done an annual physical or whatever the standard workup is that you get when you go to your physician, if you leave there and you're told you're fine, that means you're healthy. It does not mean you're healthy. It just means you don't need medical care today. You don't need a prescription. You don't need a referral to a specialist or a CAT scan or an MRI or an ultrasound. Come back when you do. The practice of medicine is treating symptoms that you already have. When you have a full-blown disease like diabetes or high blood pressure or heart attack or a stroke or hypothyroidism or liver disease, kidney disease, an immune condition, an infection that requires antibiotics, when you have something like that requires medical care, then the care you receive is likely to be excellent. The medical profession in the United States of America is the best in the world. And when you're in a crisis, when you need medical care, you will get excellent medical care. But what if you've already done that? What if you don't have something that rises to the need to justify the risks and expense of pharmaceuticals, surgery, etc., but you still don't feel right? And maybe you've been to several doctors and you've done various tests, and all your tests are normal. You get CAT scans and MRIs and ultrasounds and blood tests and any other test that seems like should identify what's going on with you, and all the tests are normal. What about that? How does that happen? Why is it? It's actually really common to go in and get a whole battery of tests and be told by your doctor that there's nothing wrong. All your tests are normal, and yet still you don't feel right. There actually is something wrong with you. If you don't feel right, there is something wrong with you, or you would feel right. The problem is the standard practice of medicine is using these broad ranges to identify conditions that are bad enough to need medical care. But if you're just inside that range, that doesn't mean you're healthy. That doesn't mean there isn't a problem. That doesn't mean there isn't a solution, a safe solution. Maybe just eating better food. Maybe doing a little bit more exercise. Maybe a different type of something different. Obviously something that you haven't been doing already. Otherwise you'd feel good. There are ways to identify these things. Functional medicine means using more tests and using a different yardstick to measure for earlier signs of stress on your kidneys, on your liver, on your heart, on your lungs, on your immune system. When you identify, and not just one thing. Most people's problems are never one thing. We want that. Our brains, we have these huge brains that we're so proud of. And it's always, we think, I do the same thing. We think, if I feel this, there must be, if I could just find that one thing that's causing all of my problems, my life would be better. Well, most of the time, if you've had a problem that's a chronic condition, chronic doesn't mean bad. Chronic means that you've had it for a while. Chronology. Chronic doesn't mean really, really severe. It could be mild. A lot of chronic conditions are mild. Chronic just means something that you've been struggling with for a while that nobody's been able to help you with. So if you have especially if you have a chronic condition, if you have anything that's been bothering you that's been going on for a while, for weeks, months, years, even though nobody's been able to help you with that, even though you've had all kinds of tests and you've been to several different doctors and they all tell you all your tests are normal, that does not mean that there's nothing wrong with you, and it does not mean that there isn't a potentially really effective, safe, natural solution to what's ailing you. So when you use the same tests, when a practitioner of functional medicine uses the same standard blood tests, but usually more of them. Why? Why more of them? Functional medicine requires using more tests than you get when you go to your standard annual physical. Why is that? Well, it's really easy to diagnose full-blown kidney disease. A comprehensive metabolic panel that most doctors will order on a routine visit includes 3 or 4 basic kidney tests, your liver enzymes, your protein levels, electrolytes, and, if you have severe inflammation of your liver, that's really easy to diagnose. If your fasting glucose is above 125 on 2 separate occasions, you get a diagnosis of diabetes, easy peasy. Or if your A1C level is above 5.6. These are common tests, really easy things to diagnose. In addition to this, most doctors will test your cholesterol because everyone needs to be on a statin drug if your cholesterol is above a certain level. Put air quotes around that previous statement. There's lots of ways to lower your cholesterol without medication. If you're lucky, they'll also test your thyroid, especially if you're a woman over 50, because a lot of women have hypothyroidism. But even then, they usually only test TSH, thyroid stimulating hormone, which isn't even a direct thyroid test. It's a pituitary test. Your pituitary makes thyroid stimulating hormone to tell your thyroid to make more thyroid hormone if you need it. And it's a good test. It's a useful test. It's very accurate, but it doesn't give you the whole picture. Most doctors will also that's not even true. In my experience, a lot of people don't. I keep thinking that most doctors test this, but in fact they don't. Sometimes you'll get a complete blood count, which is really important to do a CBC, a complete blood count. That will tell you if they suspect an infection, then they will do that to see if your white cell count is elevated, to see if your lymphocytes or your neutrophils or other forms of white blood cells are out of range, indicating you have a certain type of infection that may warrant antibiotics, for example. These are all great tests, and they constitute a good brief overview of whether or not you need medical care, but they don't tell you whether or not you're healthy. And that's why so many people go to the doctor and get the standard tests and get told there's nothing wrong with them, come back later. Let's watch and wait. Maybe even something's a little bit out of range, but not bad enough to need drugs, so it's watch and wait. Well, if you're in that situation, you've had that experience, there are other ways to see what's missing. Why didn't I don't feel right. If you don't feel right, something is wrong. So standard practice of functional medicine always includes more tests. So in addition to that CBC, for example, which among other things will also diagnose anemia. Millions of people have functional anemia, meaning it's not medical anemia. It's not far enough outside of the range. Your hemoglobin level isn't low enough that they're going to recommend medication for it. Maybe even not low enough that they'll recommend iron for it, an iron supplement for it, but you're functionally low, meaning it's outside of the range of what your hemoglobin was like when you were in your teens and your 20s. And this is really important. A slight deficiency in iron, impairing your bone marrow's ability to make adequate red blood cells to deliver oxygen to all of your cells. If that's even a little bit low, that's a constant strain on your heart. 24/7, 365. Your heart has to pump those deficient red blood cells around further and further and faster and more frequently to deliver adequate oxygen to your cells. Your body has very sensitive feedback mechanisms to ensure that you get adequate oxygen to all of your cells. And the carriers for that oxygen are red blood cells. So if there's any slight impairment in the ability to maintain all of those guys that are carrying that oxygen around, then your heart has to take up the slack by pumping the deficient red blood cells that you do have around more, which is going to, what's that going to do? It's going to increase your blood pressure. It's going to increase strain on your heart just a little bit, but all day long, all night long. That's going to have an impact. So that's one of the reasons I test a CBC on every single patient, because I often find that people have slight deficiencies in iron that's impairing their body's ability to make adequate red blood cells, that's causing their hemoglobin to be a little low, not medically low, but still low enough that it's having an impact, it's contributing to fatigue. It's something that just fixing that, just giving people iron supplements, I've lowered their blood pressure. Just giving people iron and sometimes B12. So the other really common and commonly overlooked nutrient deficiency that causes slight anemia is deficiencies of vitamin B12 and folate. The B vitamins, you almost never want to take on their own. They work in combination. So a good methylcobalamin, the active form of B12, in combination with methylfolate, the active form of folate, and a sublingual form in a tablet that you hold under your tongue, can make all the difference. So that was a lot. What is that? What does all that mean? Well, a lot of people have heard about or even tried, if they have low energy, they go and get a B12 shot. Oh, I need to get a B12 shot. Or my friend had B12 shots and he felt amazing afterwards. Well, that's not an uncommon experience, because a lot of people are deficient in vitamin B12. And, when they do those shots, they usually include folate and sometimes some other things in with it. But a lot of people are deficient in vitamin B12 for several reasons. There's a genetic SNP that about 15% of the population has that makes it very difficult for you to absorb vitamin B12 from food or even from supplements that you swallow. A lot of people have deficient hydrochloric acid in their stomach, which is essential to break down the vitamin B12 in food and in supplements that you swallow. And then that broken down, prepared vitamin B12 isn't absorbed until 20, 30 feet later at the very end of your intestine. And, that's a couple of examples. There are several other reasons that are testable, that come up all the time. And I don't recommend necessarily testing your blood levels of vitamin B12. The only really purpose to do that, the only reason you ever want to do a serum vitamin B12 or folate test is if you suspect a liver condition that's impacting those levels. People are often surprised. They go to their regular doctor and they come back and say, oh, I had my vitamin B12 level tested and it's off the charts. It's really, really high, or my folate's really high. I said, that's normal. If you take a vitamin B, an effective vitamin B12 and folate supplement, then your blood levels of those vitamins will always be really, really high, because the test is assuming that you're an average person who does not supplement those things. So it is totally safe to have a really high blood level of vitamin B12 and vitamin folate if you're supplementing. That is the way it will always be. But you don't need a shot. Very few people need to get an injection if you take the active form, the methyl form, methylcobalamin and methylfolate, in a tablet that dissolves under your tongue. Because then it also goes directly into your bloodstream. Under your tongue, it gets absorbed directly into your bloodstream. It's as effective as getting a shot. It's a lower dose, but for most people, it's as effective as getting a shot. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. We're talking today about some of the things that people experience when they go to a regular doctor's visit, an annual physical, the routine visit to your gynecologist, your gastroenterologist, your internist, whoever your regular doctor is that you check in with once in a while, or who you go to when you're just not feeling right. And this frustrating experience that so many people have, where they come away from that visit to their doctor and they're basically told, you're fine, there's nothing wrong with you, let's watch and wait, come back when you're bad enough to need the big guns that I offer in the form of drugs and surgery, etc. That's a slight exaggeration, but I'm just trying to address this huge gap that exists between the practice of modern medicine and the difference between that and a way to assess whether or not you're truly healthy. And it lies in doing more tests to identify earlier signs of stress on your various organs and tissues, and then applying years of experience and evidence-based protocols to help your body heal itself. So what does your blood tests look like when you're in your teens and 20s and everything's working perfectly? That's what we call the functional range. It's roughly the middle third. So if you look at your regular blood tests and what are called the normal medical ranges, outside of which medical care is indicated, if you look at the middle third of those ranges, it varies from test to test, but roughly the middle third is what most people will find, most doctors have found, the research shows, years and years of experience shows, this is what your blood work looks like when you're in your teens and 20s and everything's working perfectly. That's what we call normal function. So when you use that metric in addition to the standard medical range and see if you have areas that different tests whose numbers are outside of this narrow functional range, maybe these are indications that you have some kind of inflammatory process that needs support with something like a good form of turmeric. And I stress a good form because a lot of turmeric supplements are not very bioavailable. It's notoriously difficult to absorb, but there are good forms that can dramatically change inflammatory markers on your blood tests, like C-reactive protein, sedimentation rate. There are specific tests that measure for inflammation in your body, and when you take something, you should see a difference in those tests. That's how we know we're restoring normal function. Another common thing that comes up a lot is people are borderline deficient in thyroid, not necessarily indicating that you need to be on thyroid medication for the rest of your life. And even if you're already on thyroid medication for low thyroid, for hypothyroidism, if you've only been on it for a few years, sometimes you can just take some nutrients that improve your body's ability to make thyroxine, and especially, really importantly, to convert the thyroxine, the drug that you get if you put on Synthroid or levothyroxine, that is T4 thyroxine, that is the main hormone produced by your thyroid gland. But it doesn't do anything in your body. It's the inactive carrier form. To make your thyroid work normally, your body has to convert T4 into T3. And it has to convert a tiny portion of that T3 into unbound free T3. So most doctors never test this. They just test TSH. If you're lucky, they might test your T4 levels. They very rarely test T3 and almost never test free T3. And that's the most important test. That's the active form. Millions of people take Synthroid or levothyroxine, same thing, brand name, generic name, thyroxine medication for low thyroid, and they're not getting the results they want, that they expect, because their body's still not converting adequate amounts of that carrier form into the free, unbound form, T3, which is the form that actually executes the function of the thyroid gland. This is something that comes up all the time, especially in women over 50 who have hypothyroidism, may not even know it. And there are supplements available that enhance your body's ability to increase the production of thyroid where needed, and especially to convert the T4 into the free T3 active form, and it makes all the difference. If you know someone who has unexplained fatigue, difficulty losing weight, hair loss, cold hands and feet, puffy face, these are the most common signs of low thyroid, but low thyroid also increases your cholesterol levels. If you want to not have to take statin drugs for the rest of your life to lower your cholesterol, then it's really important to check your thyroid and make sure that your body is able to carry out the functions of the thyroid hopefully without becoming dependent on medication for the rest of your life. Well, it's bad enough to become dependent on medication, but even worse is if you go to your doctor and get told that you need something that you really do need, and you can't get it because your insurance won't pay for it. Here's a really interesting piece that came out in the medical press this year titled "Stuck in Prior Authorization, Some Patients Run Out of Options." And the subtitle is "Many Doctors Complain That Insurance Denials Are Worse Than Ever." Right? Can I hear an amen? A lot of people are experiencing this. It's always been a problem. Insurance, they do have to obviously put checks on expenditures. If they just authorized every single thing that every doctor recommended, then they'd run out of money pretty quickly. So it's obviously, they do have to do some kind of evaluation of whether or not you need, but it's just everyone knows this already. All doctors know it, all patients, everyone's experienced this. Their denials are ridiculous. It's just like pulling teeth to get them to pay for anything. You've paid in your premiums, you've, donated your payroll contributions to Medicare and, paid your premiums on your health insurance, and you go to a doctor who's obviously done the right tests, done a proper diagnosis, and recommended medical care for you, and still your insurance denies it. The article highlights the case of a man named Eric Tennant, who was diagnosed in 2023 with a rare cancer of the bile ducts that had spread to his bones. He weighed 97 pounds and wasn't expected to survive a year because he had stage 4 cancer. Well, he had grueling rounds of chemotherapy that slowed the cancer's progress, but it did continue to spread, and so they're looking for other options. And the 58-year-old man's wife had recently had reason to hope that things would improve because she learned of a new non-invasive procedure called histotripsy, which uses targeted ultrasound waves to destroy tumors in the liver. The treatment could potentially extend his life and buy him more downtime between rounds of chemotherapy. Well, I'm not familiar. I'm not an oncologist. I'm not familiar with this particular procedure. But most of the time, when you're using something that applies ultrasound, that's a pretty inexpensive form of therapy. It's got to cost less than chemotherapy, which insurance companies authorize all the time. But the problem is, even though this man's oncologist told him he was a good candidate for this procedure because the largest tumor in his body was in his liver, and that's what this is documented to work on, his family had to fight another battle, an even bigger battle than the cancer itself, and that is the battle with their health insurance, because they decided the treatment was, quote, say it with me, not medically necessary. What does that even mean? Health insurers deny millions of claims every year, and they're often denied by consumer service representatives that don't even have any medical training. Well, that's a mess, and I don't know how to change that anytime soon. What I try to do instead is offer you ways to take better care of your own health so that you don't end up in that situation. And when you do, there are often options that you can do yourself, and I try to make them as affordable as possible. It often costs much less than you might imagine to get comprehensive functional testing that'll identify things that you can do to enable your body to better heal itself, even when you have severe conditions. I'm Dr. Todd Binkley, talking about safe, effective, natural alternatives to standard medical care when indicated based on testing. And I'm looking at the calendar now, and I'm realizing when I started this program 2 years ago, I could only imagine the response I would get. And it has been a profound blessing. So thank you to all of you who keep tuning in and keep sending me questions and keep informing yourselves so that you can take better care of yourselves by it requires taking responsibility for your own health. If you don't want to end up in that morass of insurance denials and waiting till it's too late, and the only thing is modern medicine, things with lots of side effects and are not fun. You got to take responsibility for your health. So I appreciate you tuning in and letting me arm you with the things that you can do to make better health choices and hopefully prevent ending up in a situation like that. I spend a lot of time each week perusing and reviewing the medical literature, coming up with interesting topics to present to you. People are always telling me I've got a great voice for radio. That's nice. I love doing it. I love doing this show. But I also want to I'm excited to announce that I also love doing live presentations. And I have a number of them already prepared that I've done for years at Rotary clubs and at local hospitals and at various organizations, PowerPoint presentations. So I'm happy to announce that in addition to this radio show, I'm going to add and invite you to join me once a month, live in my office. I'm calling it Live at Binkley Healing Center. I'm going to do a 30-minute talk with some light refreshments and a Q&A, answer your questions afterwards. Bring your friends and family every first Wednesday of the month. The first Wednesday of the month, every month, live in my office in downtown Ventura, 961 East Main Street. You're invited. Please come join me. Bring your friends and family. There'll be a different topic each month. October is Breast Cancer Awareness Month. I don't know about you. I think it should be Breast Cancer Prevention Month. So on October 1st, I'm going to be talking about how to reduce your risk of getting breast cancer in the first place, how to reduce the risk of recurrence if you've already had it, and if you're in recovery, how to reduce the risk of the debilitating side effects that accompany standard cancer therapy. So to reserve your spot, text 805-612-5531. I'd love to see you there on October 1st. Thank you for listening. Remember, the condition of your body is always more important than any condition you've been diagnosed with. Have a fantastic weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 2 p.m. for Safe, Effective Natural Solutions here on 98.3 FM, The Word.